when I started Wait Till It's Free, I thought the film was going to be a story about the patients. Certainly when you look at a movie like Sicko, Michael Moore's film, it's focused on the patients, and I was thinking along those lines as well. I realized very quickly that the bigger story was about the doctors and the doctor-patient relationship, and that's the essence of what healthcare is. It's the providing of medical services. That's really what we're talking about. And so when I get back to that premise, when I started thinking in those lines, I realized that what you do to the American doctor, you do to the patient as well. So everything the government has done in intruding into that doctor-patient relationship has harmed healthcare in America. So it became a much bigger story at that point. And I actually started to develop a sympathy for the doctor. So instead of it being, as Michael Moore would do, the sympathy for the poor patient who can't get the insurance company to pay for his needs, it actually became, I think, a better story, because there was two parties that were victims to all of this. Not just was the patient was being abused by the government through limitation of choice, but the doctor was losing an incentive even to practice, was burdened by bureaucracy, all those things that really damaged the doctor's liberty, and of course the costs and annoyance and all the burden that the government puts on the doctors is passed directly on to inconvenience for the consumer, the patient. Healthcare is just a critical part of our lives, and after education, which is the most influence philosophically, our actual well-being and how we live our lives is really dependent on what kind of healthcare system we have. It's such a big part of our lives. We have babies, and eventually when we are at the end of our lives as well, and all of the big events in our lives too, when we have an accident or whatever, it's such a big part of our lives. We can't get around the fact that when the government takes over our healthcare, it takes over so much of our lives, and that's a critical issue here. And also, the issue for me with indoctrination about the public school system was the idea that you can't be neutral in education. So when you present the idea of education, you're not talking about neutral territory. You're talking about a narrative that's completely grounded in a worldview. And so when they are educating, they have to be educating from a particular worldview, which we often, as Christians or conservatives, would oppose. And so that's why we argue very clearly for a Christian education system where it's separate from the government control, so homeschooling and private schooling. The narrative holds up in the same way for healthcare, that we would argue that healthcare isn't neutral either. So what they call healthcare isn't what we would call healthcare, because you and I would think of healthcare as broken legs and heart attacks. That's not what they're talking about. When Obama and all the rest of them are talking about healthcare, they've drawn this huge line that includes, psychotherapy and abortion rights and, eugenics and euthanasia, in my mind. All those agendas that drive the left. And those things that we really need to be concerned about. So the taking over of healthcare is no small thing. So that's why I thought this is the film that we need to follow up indoctrination with, because it's as important as an issue to me in terms of how it affects our lives.